Okay, next we're going to be testing for both medial and lateral epicondylitis, also known as tennis elbow and golfer's elbow respectively. So we're going to start with tennis elbow, so testing for lateral epicondylitis. I've got my patient seated. We're going to kind of have the hand resting off the table so we can kind of look at full range of wrist motion here. But the first thing is I'm going to do is I'm going to find the patient's lateral epicondyle and just kind of keep my fingers here. And I'm going to bring my patient into a position of wrist flexion. I'm going to ask her to flex her fingers and then try to extend up while I provide some concentric resistance there. And then when she's in this position, I'm going to move her down, all the way down into flexion with a little bit of overpressure. And a positive sign for this would be pain right where my fingers are palpating on the lateral epicondyle. I could more accurately diagnose this as a tear at the osseous attachment site by moving my proximal fingers just a little more distally, so I am pinching on the tendon rather than on the osseous attachment site. And by repeating that test with a diminishment of symptoms, we could really identify that it is the attachment site on that lateral epicondyle that is our primary issue. Next, for golfer's elbow or medial epicondylitis, I'm going to have my patient flex hand and elbow, and I am going to provide some resistance and bring them into full extension, kind of palpating again right at that medial epicondyle this time. And any pain where my fingers are would be indicative of medial epicondylitis or golfer's elbow.